Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Primary cleft lip and the palate procedures. We are looking at the timings. So first is under the cleft lip alone. So if you look at the cleft lip alone, so here it is unilateral. So there is unilateral, that is it includes one side. So unilateral means it includes one side, and here there is one operation at 3 to 6 months. So there is one operation and this takes place between 3 to 6 months. Next is bilateral, that is it involves both the sides, and here there is one operation at 4 to 5 months. So there is one operation which is at 4 to 5 months. Then we move on to the cleft palate. So in terms of the cleft palate, there is a soft palate. So when you look at the soft palate, here there is only one operation which takes place at 6 months. So there is one operation which takes place at 6 months. Next, when we are looking at the soft and the hard palate, so soft and hard palate. So soft and hard palate, there is presence of two operations. This presence of two operations, so the soft palate at 6 months. So there is soft palate. This takes place at 6 months, and then comes the hard palate. The hard palate takes place at 15 to 18 months. Now we move on to the cleft and the palate, cleft lip and the palate. So under the cleft lip and the palate, so here there is a unilateral as well as the bilateral. So under unilateral there is presence of two operations. So unilateral has two operations. So the cleft lip and the soft palate at 5 to 6 months. So the cleft lip and the SP, that is the soft palate, and this is at 5 to 6 months. Next is the hard palate. So next is the presence of the hard palate as well as the gum pad. So hard palate and the gum pad, and this is with or without the lip revision at 15 to 18 months. So it is with or without the lip revision, and this is at 15 to 18 months. Next we look at the bilateral. So under bilateral there are two operations, and there is a cleft lip and the soft palate. So there is a cleft lip as well as a soft palate, and this is at 4 to 5 months. Next is the hard palate. So hard palate as well as a gum pad. So hard palate and the gum pad. So this is with or without the lip revision at 15 to 18 months. So this takes place at 15 to 18 months. Now let's look at the secondary management. So here in secondary management there is a hearing. There is presence of hearing, and there is also the prophylactic myringotomy. There is prophylactic myringotomy. Next is there is a regular audiological testing. So there is a regular audiological testing, and this takes place at 6 to 12 months. Then there is speech. There is presence of speech. There is a velopharyngeal surgery. Velopharyngeal surgery. Next is the speech and language therapy. Speech and the language therapy. So this takes place at 18 months. Next is the orthodontic management. So in terms of the orthodontic management, there's a mixed dentition. The mixed dentition takes place from 8 to 10 years. Then comes the permanent dentition. The permanent dentition is from 14 to 18 years. Then we look at the excision of the maxillary arch and the rhinoplasty. So in terms of the excision of the maxillary arch as well as the rhinoplasty. So here this is indicative of 16 plus years. To learn and grow daily like this, please do subscribe.